Hello, everybody. This is Mr. Ueda on our show. Welcome, Mr. Ueda.
Good morning. Good morning. I just woke up. I'm in the middle of working, so I have to go to the ward for a round.
That sounds like a very exciting job you have out there.
So not necessarily. Not necessarily.
So,
Well, it's kind of it's a dirty job.
well, I'm
I'm a
sure
kind of
you...
janitor in the hospital.
Say that again?
I'm a kind of a janitor in a hospital.
You're a
Well,
specialist.
well, that's actually virtually that's what the medical doctor is all about.
Well, you gotta tell us a little bit more about it, because in Japan or anywhere in the world, people respect doctors because we cannot do without them. And tell us a little bit more about your medical profession.
So it's kind of difficult because what we take it for granted is a kind of surprising news to the lay people. So you want to ask me what's going on in the medical world, in the medical field, then I can answer you.
Oh, okay. So
And
what
that would
are
be
the
it.
pressing issues right now facing the medical profession in Japan?
So there, whereas I think there are many important issues going on in the medical world. I think the vaccines about against rubella uh, is really controversial and provocative issues right now in Japan. Rubella. Do you know it? Hushin,
Oh, okay.
Hushins.
So what's the issue? Is it like the issue whether to do the vaccination or not?
Vaccination is, I think, rubella itself is uh, not serious medical stage, but the problem is that the pregnant woman contracted that disease, rubella. I think the problem is that the child, I mean, the baby is going to have the cold, when the congenital syndrome is intrigued by the contracting rubella. As a congenital, so for example, the cardiac problems. I forgot the names and Hushin Shokogun, sentence Hushin Shokogun. So
So I
congenital,
guess that sounds like a very serious problem. So I guess you have to do lots of vaccination to
right,
prevent. Okay.
right. But the problem here is that I mean, there a serious shortage of the vaccinations, the vaccines in Japan. Yeah.
Okay.
The vaccination is always the hot issues, the hot medical issue, but uh, well, I think as a group of people are against the vaccinations. It causes lots of problems, although it has definite benefits to the people, the vaccinate the persons. But it causes the serious, I should forget what it was, serious problems, like,
Side effects
including
and
side effects, including death of the people. And so when it comes to the rubella, I think it is a must that we have to go on and get the supply of these vaccinations, and otherwise that it will cause so many serious issues, especially for the baby and its mothers.
what's the number top two issue in the medical field right now?
The other issues
Yeah, another
you were
one.
asking, so the other
Uh-huh.
issues. Well, there are many issues right now. For example, right now, Japan, especially east part of Japan, is in the middle of recovery, rehabilitations, I mean, revitalizations after devastations of the earthquake, and that's the ongoing issue in Japan.
Okay. Are there enough doctors to be located, to be stationed?
Not enough. I think shortage of the medical doctors is a nationwide issue. Whether it's the west part of Japan and east part of Japan, but especially that's in the issues in the east area of Japan, and especially in the Tohoku area of Japan.
I understand that in Japan it doesn't take too many years to become a doctor compared to countries like the United States, right? Because you go to the medical university and then finish it, as opposed to in America you finish your BA perhaps in medical science or biology science, health science, and then you're going to have to go to a medical school to become a doctor. So it takes so many years of your lifetime. But in Japan, production of medical doctors, it should be more efficient. Why are
Well,
you
I don't think
facing?
what. Well, I don't think so. So, well, used to be the medical education student in Japan, so after graduation of the high school, 6 years, as opposed to virtually 8 years in the United States. As I understand, for example, you have to graduate college or university. Then after going on to the medical school in the United States, and it takes about 8 years. But in Japan, and after the graduation of the medical school in Japan, you're going to go through the period of what is called the residency. That takes about 2 years. So it's totally 8 years. So not much of a difference in comparison to the systems of the other countries.
That makes sense. And you have to be paid really well to be, providing incentives for people who want to become doctors. If you have to go through all the training, that's going to take as many as 8 years or 6 years. Yeah.
Oh, I think it's virtually 8 years to be
Yeah.
a full. Well, actually, the 8 years is not the whole medical training is not done yet. After the completion of the 8 years, they have to go on to the secondary training period after those 8 years. I mean, 2 years after the graduations.
Okay.
So
I, I,
to
I,
be a full-fledged doctor, it takes many years.
I have one question. You always do a lot of. I notice you always do a lot of night shift. So
Hmm.
people would come in with lots of problems, right? So virtually you have to respond to every possible symptom or every
Hmm.
possible thing that exists.
Hmm.
How do you deal with such a situation which you might have never encountered before, such as gunshots, or have you treated a
Whereas,
gunshot wounds before?
well, I think the basic things that there are a bunch of cases that I haven't seen yet. Very unusual cases, like you said, the gunshots. But I think the top of the priority, what I have to do when I see the patient is that the reassurance of the vital signs of the,
Mm.
or what I mean, the state of how should I say it? 血行動態. I think um, for example, what I mean by vital sign is the blood pressure and heart rate and body temperature, stuff like that. So, it shows the state of the whole human body. For example, if the blood pressure is going lower, that would be fatal if it is around the 60. I mean, uh, if the blood pressure is above 100, that's okay. That means you know that the bloodstream is going through the very important vital parts of the body. That is brain and heart. Now, that's the two vital organs to maintain the life of a human.
Right.
So the blood pressure is going lower. You can't supply the blood to the very important parts of the body, like brain, and so the brain is going to die in 5 minutes. So whatever the case is, what we have to assure is that we have the good blood supply that is indicated by means that's visualized by the blood pressures, and we have to make sure that the blood pressure is say above around 90 or something. That's whatever the case is, we have to do something stuff like that. So the gunshots that is most fatal about the gunshot is that you have the bleeding. Yeah, if you lose blood to an extent, you cannot maintain the blood pressures, and that's fatal. That's lethal.
I have one quick question. I recently took a course in CPR, and the first thing we really learned was to secure airway, air
Right,
breathing.
right.
But you
Right,
didn't mention any of that. Is that because if they're not breathing by the time they arrived in the hospital, they're dead, or
Actually, you took that course, and how many years ago? How many years
a
ago?
couple
It's a
weeks ago, 2 weeks
couple of
ago?
weeks ago. So
Yes.
right now, I think the top of the priority is that the compressions of the chest before making sure you have the good respirations, because as I said earlier, the supply of the blood is the most important. That is way above the making sure of the respirations. So the first you have to make sure that if the patient has the blood pressure or not by if the person lose the consciousness. Losing consciousness. That means that you say hi, that the patients don't respond or doesn't respond to your saying hi to that person. Are you okay? And that means you have to start the resuscitations by means of the compression of the chest.
So-called 心臓マッサージ.
はい、そうです。
Okay. I learned how to use the thing. I forgot the name of it. It's the machine that has two things and you put them on the chest.
AED?
AED.
Mhm.
Yes. Yes.
That's important.
Yep. So is your job super difficult when,
Well, I
or
think whatever the jobs whether it's a dishwashers and things, the basic principles is the same. Whether you're doctors, whether you're dishwashers, and I used to be with dishwashers. That's my main job when I was
right?
when I was in my 20s. But I think it's a matter of getting accustomed to.
But it takes a lot of analyzing, right? Given the
Right.
problems and locate
Of
where the
course.
issue is and stuff. So
Yes,
it
of
takes a
course.
lot of brain power. Is it like
Well, I
you?
think
Yeah.
whether it's a medicine, whether it's learning languages, the process. The process of being better is that the first you have to use your brain. You have to think, but as you get accustomed to it, the responses become more and more automatic.
Was there
You
any
don't.
case that you encounter and you say, I have no idea what's going on?
There are a bunch of things that I have no idea about it. It's a mystery. And I think it's whether you're medical doctors, you can't say that you know everything. Yeah, you always face every day. Day after day, you have to face the moments that I don't know anything about it. You have to be humble about it,
Yeah.
and you have to be honest about it, and that's why you can better. That's how you better yourselves.
What's the most enjoyable aspect of your occupation, if you can share it with us?
Well, there are so many wonderful things about being a person working in hospitals, whether you're a nurse uh, or medical doctors, and you are. The patients and the patients' families and come to you, and we thank you very much. That's a wonderful moments, and every day we learn something more, and we grow up in these professions.
That's a maybe you can also conclude this by telling us what's the more difficult part of this profession.
There's difficult part of it. Well, it's difficult jobs. Well, there are so many things that I have to learn, and every day I'm facing the ignorance of my knowledge, of my skills, and that's why I have to better myself. Well, it's a difficulty, but at the same time, it's a joy.
Sounds good.
Like learning English and things. Everything's to improve, to better yourselves. I think is something in common,
Right.
whether it is medicine, whether it is learning languages, and whatever.
I have to ask you one more question because you just brought this up because you are devoting your time on, can I say, English education in Japan, while at the same time your job is your everyday, day-to-day work is being a medical doctor and help people with people's medical needs. What's that all about? Is what people will say, why are you doing two things?
Well, I think the problem, one of the biggest problems in the English education in Japan is that the only the English teachers who is engaged in English language all the time and all day have the right to teach English. Well, I think the English language is required by the persons who is working besides learning English. For example, so the medical doctors, we are engaged in medicine, and at the same time, sometimes we need to use English. We need to see the patient. We need to treat the patient who speaks only English. I mean, the foreign people. I mean, non-Japanese patients. So I think that we need to come up with the methods that we can learn English while you have other professions. But the English teachers, I think, is only engaged in English language. They don't know how to manage the time. So that's why the person like me is required in this field. So I can come up with the methods and about how you can learn English while you have a profession.
Right.
The time is limited. We all have to go through the limitations of the environment. I mean, we have very little time to learn English, but we can manage it. And how you can manage it, and that's where I can come in and I can share with the students who always have the same problems.
If I can add, maybe also people or students or young people see you with professional work, and then also at the same time you speak English and you're learning new things probably by reading of
Mm-hmm.
medical journals and articles. So you are kind of
Mm-hmm.
showing an alternative way
Mm-hmm.
of um, showing significance of
Mm-hmm.
learning English,
Right.
which is what's kind of a little bit difficult for maybe English teachers. I mean, I'm sure they do a good job,
Mm-hmm.
reasonably good
Mm-hmm.
job,
Mm-hmm.
teaching grammar, reading stuff,
Right.
but you can provide a very different and unique perspective on all this.
Mm-hmm.
So,
Right.
yeah, thank you for this conversation.
はい。ちょっと日本語ではもう起きたばっかりでね、英語がなかなか出てけえへん。
But there's so much to learn from you,
うん
so I look forward to continuing this conversation further.
はい。はい。
はい。
ちょっと今日は全然、いつもね、英語喋る
はい。
とき、十分シャドーインとかして臨むんですけど、今日は全くしてないで、なかなかあれでしたけど、
まあ、その過
まあ、
酷な状況にも
はい。
かかわらず、パフォーマンスを見せていただきまして、
もう、アップしてください。もう、恥かい
はい。
てなんぼで、恥かいてなんぼですから。はい。はい。
僕なんかも、やっぱり日本人と日本人なので、チョッピーになりがちになったりとかするので、でもまあ
はい。
恥はかいて、また話
そうですね。
ですけどね。
もう恥かいてなんぼですからね。
恥かいてなんぼですからね。
はい。
その
はい。
あたりも、
はい。
英語の先生じゃないからできるかもしれない。
そうですね。だから、英語先生じゃないから、限られた時間でね、
うん。
限られた時間でどうやったらいいかっていうことは伝えられるという、さっき言いましたけどね。えという
はい。
ことで、じゃあ、会心行ってきます。
はい。
会心行ってきます。はい。
ご苦労様です。
します。
はい。